Welcome to the POCUS series. I am Dr. Gopal Krishan Jalwal, Assistant Professor in Anesthesia Department. Today in this video I will explain about the airway ultrasonography and what are its clinical implications. So let's start with the larynx anatomy. Here I am going to tell the anatomy that is relevant to the airway ultrasonography. In this diagram here you can see the tracheal cartilages. Tracheal rings are C-shaped structure and protects the trachea. And just above the tracheal cartilages, you can see the cricoid cartilage. So cricoid cartilage is also known as a signet ring, and it is the only cartilage that completely encircle the trachea, and it has two parts. Anterior part is known as a arch, and posterior part that is wider than the anterior part known as a lamina. And just above the cricoid cartilage, here you can see the cricothyroid membrane. Cricothyroid membrane is a very important structure pertaining to the transtracheal injections or emergency cricothyrotomy. And here you can see the thyroid cartilage. So thyroid cartilage is a half open book shaped structure, and two halves of the thyroid cartilage meet into the midline and forms a prominence Adam's apple. And here you can see the hyoid bone, and this is a epiglottis. Epiglottis is a leaf-like structure and that protects the trachea. So airway ultrasound, knowing the cross-sectional anatomy of the neck is paramount. Here I am showing a schematic diagram of cross-section at the thyroid cartilage. And in this diagram you can see this is the skin and platysma, and just below the skin and platysma these are the sternohyoid, omohyoid and thyroid muscles. These are also known as strap muscles, and on the lateral side you can see the sternocleidomastoid muscles, and at the center you can see an inverted V-shaped structure that is the thyroid cartilage. And at the center of thyroid cartilage here you can see the vocal cords. This is a glottic opening, and at the base here these are the retinoid cartilages. This is a schematic diagram of cross-section view of the tongue. So tongue has three parts: tip, body and base. So and tongue is made up of two type of muscle groups: intrinsic muscles and extrinsic muscles. So these two muscles contribute to tongue movements in a different direction. But in the sonoanatomy, you will see tongue looks like a striated appearance. That striated appearance is because of intrinsic muscles. And when you place your low frequency curvilinear probe in a vertical direction, you will see these muscles: mylohyoid, genohyoid and genioglossus. And you can also visualize the upper surface of the tongue and hard palate as a hyperechoic line. So these are the few terms will be used in this video to explain the airway sonoanatomy. Airway ultrasonography can be divided into the two parts, suprahyoid and infrahyoid. As the suprahyoid structures are the deep, that's why we use the low frequency curvilinear probe, and the infrahyoid structures are superficial, and for that we use the linear high frequency probe. Let's start from the infrahyoid structures with the linear high frequency probe. For the first view, I am going to place this linear high frequency probe just above the suprasternal notch. So you will get this view, and now I am going to freeze it and will explain. In this sonoanatomy, this is a skin subcutaneous tissue, and this hyperechoic continuous line is a platysma. And on the lateral side of this sonoanatomy picture, you can see a thick muscle that is the sternocleidomastoid, and here these are the strap muscles. This is a sternohyoid, this is a omohyoid, and here this is a thyroid muscle. And on both side, here and here, this is a thyroid gland, and this is the right lobe, and this is a left lobe, and here this is a isthmus. And this anechoic round structure is a carotid artery. Now come to the center. In the center you can see this a U shape, inverted U shape structure, that is the trachea. And just below the isthmus you can see an inverted hypoechoic U shape structure in tracheal ring. And just below the tracheal ring there is another hyperechoic curvilinear line, that is the air tissue interface. And this is a trachea. When you are at the level of the suprasternal notch, then if you move your probe on the left lateral side of the midline, you will see this sonoanatomy. Now you can see this is a skin subcutaneous tissue, and here this is a platysma, and these are the strap muscles, and this thick muscle is a sternocleidomastoid. And just below the strap muscles, this homogeneous appearance is of thyroid gland. And this inverted U shape, here you can see this is a trachea, and just left side of the trachea you can see a concentric structure, that is the esophagus. Most of the patient esophagus is not visualized while airway ultrasonography. Then you have to ask the patient to swallow the saliva, then you can appreciate the esophagus. And this is a carotid artery. When you move your probe 2 centimeter above the suprasternal notch in a upward direction, then you will get this image. So in this view you can see this is a skin and subcutaneous tissue, and this is a platysma. And here you can see this hypoechoic structure. These are the strap muscles. The strap muscles include thyroid, sternohyoid, sternothyroid, and omohyoid muscle. And just below the strap muscles you can see a structure that is having a homogeneous appearance and slightly hyperechoic compared to the surrounding structure. This is a thyroid gland, and thyroid gland is a butterfly shaped structure. And this is a right lobe of thyroid, and this is a left lobe of thyroid. This is a isthmus. Just below the isthmus you can see this there is a hypoechoic U inverted U shaped structure, that is the tracheal link. And just below the tracheal links there is another hyperechoic curvilinear line, that is air tissue interface. When air comes into the contact with the tissue, that appears as a hyperechoic structure. And just below this hyperechoic structure you can see few more hyperechoic line below the air tissue interface, that is because of reverberation artifact. And here you can see this is a trachea. Now I am moving my probe in a cephalad direction from the thyroid gland, and here you will get this view. In this sonoanatomy, you can see the skin, subcutaneous tissue, platysma, and these are the strap muscles. And here you can see the thyroid gland. And when we come to the center, you will see that a inverted U-shaped structure or a horseshoe-like appearance. That is the cricoid cartilage. In this image, cricoid cartilage is isoequivalent to the surrounding structure, but appearance of the cricoid cartilage depends on the calcification. If cricoid cartilage is calcified, then it gives the appearance of the hyperechoic structure compared to the surrounding tissue. And in healthy patients, in most of the healthy patients, cricoid cartilage is a hyperechoic or isoechoic structure, as seen in this image. And this is a air tissue interface, and this is a trachea. When you move your probe just above the cricoid cartilage, you will get this image. So this is a transverse view of the cricothyroid membrane. So in this view, you can see skin, subcutaneous tissue, platysma. These are the strap muscles, and here this hypoechoic structure is the cricothyroid membrane. So in the transverse view, identification of cricothyroid membrane is difficult, but that's why the preferred method for the cricothyroid identification is a sagittal view. So there is another technique, that is the Taka technique. By the Taka technique, you can appreciate the cricothyroid membrane in a transverse view that has been explained later in this video. So this is a air tissue interface. So the just above the air tissue interface, that is the cricothyroid membrane. When you move your probe just above the cricothyroid membrane, you will get this image. In this view, you can see skin, subcutaneous tissue, platysma, and on the strap muscles on the bilateral side. And one more important finding here, you can see that this inverted V, that is hypoechoic in nature, that is the thyroid cartilage. So in the sonoanatomy, thyroid cartilage looks like an inverted V-shaped structure and hypoechoic in nature. And at the center of the thyroid cartilage, you can see some hyperechoic structures, and here these are the vocal cords. Okay, and here here on the bilaterals you can see the vocal cords, and this is a glottic opening. And at the base of this picture you can see a few more hyperechoic structure, that those represent the arytenoid cartilage. So when patient speaks, then you can appreciate the adduction movement of the vocal cord. So हाँ बोलिए. So when you move your probe above the thyroid cartilage, you will see a face-like structure with eyes and mouth and nose. Here these eyes are the strap muscles, and this is a mouth, and this is a pre-epiglottic space, And in this face-like appearance, mouth represents the epiglottis, and just above the mouth, this is a pre-epiglottic space, and you can measure the distance from the skin to epiglottis. When you move your probe slightly in a upward direction, you will see a arch or bow-like structure, and now I am going to freeze it. Or here you can see this hypoechoic structure or slightly hyperechoic, that is the hyoid bone. Okay, and below this is a tongue. When you place the high frequency linear probe in a sagittal plane just above the suprasternal notch, you will see this view. In this view, you can see string of beads, and this oval-shaped structure is the cricoid cartilage, and these are the tracheal links as a string of beads. And from cricoid cartilage, you can count the tracheal rings. This is the first tracheal ring, and this is a second tracheal ring. This is a third tracheal ring, and just above the tracheal links there is a you are seeing a homogeneous structure, that is thyroid gland, and just below this tracheal link there is a hyperechoic continuous line, that is the air tissue interface, and just below this air tissue interface, that is the trachea. So move your probe in a upward direction in a sagittal plane or in a longitudinal orientation. You will see this image, and now I am going to freeze it. This is a oval shaped structure, that is a cricoid cartilage, and here are the tracheal rings, and this is a air tissue interface, and just above the cricoid cartilage there is a gap, and here this is a thyroid cartilage. Okay, and this is a cricothyroid membrane. Okay, and these are the strap muscles, skin subcutaneous tissue over it. To visualize the suprahead structure, especially the tongue, we use the curvilinear low frequency probe. Let's see. First, I am going to place this probe uh, in transverse orientation just below the mentum, and now I am going to freeze it. So the tongue looks like a fan-like structure, and this is a skin subcutaneous tissue, and this is a space around the tongue. Okay, and tongue in the sonoanatomy gives a striated appearance, and that is because of its intrinsic muscles. And just around the tongue, you can see this is a space, and here it is a hard palate. Sagittal view of the tongue, you have to place this low frequency curvilinear probe just below the mentum in a longitudinal plane, and you will get this view.
I am going to freeze this picture. Okay. And will explain you. So this is a mylohyoid muscle, and this is a geniohyoid, and this is the genioglossus muscles of the tongue. Okay, and here you can see this hyperechoic line is the posterior surface of the tongue, and here this hyperechoic line is the palate, and this part is the mentum, and you can see the acoustic shadow of the bony mentum, and this is the hyoid bone, and you can also see the acoustic shadow of the hyoid bone.
These are the few clinical applications of the airway ultrasonography. After identification of the cricothyroid membrane in sagittal pain, you have to place the angiocath or IV cannula just below the probe, and then you have to move the cannula till you reach the cricothyroid membrane, and then you have to mark there. In the Taka technique, when you scan from the thyroid cartilage to the cricoid cartilage and then back from the cricoid cartilage to the thyroid cartilage, you will see a bright air tissue interface. That bright air tissue interface area belongs to the cricothyroid membrane. This is a mentum and this is a hyoid bone. Okay, this is 5.21 centimeter.